This assignment is the SBAR, which stands for Situation Background Assessment Recommendation. In this scenario, I'm going to be contacting the doctor, and based on my assumption, because I couldn't find any other information on preferred way of contacting the doctor, I'm going to say his cell phone, even though it's late at night. But I'm going to go for his cell phone because this patient is critical. Um, I'm going to start by introducing myself and saying, "Hello, doctor. This is Nurse Eddie at AMU. I am currently taking care of one of your patients, Mr. O, in room 512, which I made up the room number. Situation as of 21:30, Mr. O is not doing well. The PCA took him to the bathroom and observed black tarry stool and was complaining of not feeling well and blood pressure, and his blood pressure is very low, 94/66. Background is he is 63 years old, that he was admitted at 1600 hours today. The cause of admitting him was syncope. The previous nurse did an assessment on him, and his vital signs were in the normal range. BP, blood pressure 138/84, pulse was 76 and regular, respiration rate 16, temperature 98.6, and no oxygen saturations were taken at this point in time. And labs came back normal based on the information of the scenario. His IV infiltrated during transport, and a new IV was started, and warm compress was applied to the old site. No known allergies noted. The only medication he is on at home is NSAIDs for chronic back pain. Unknown how much he takes daily and how long he's been taking it for. Mr. O was dizzy and lightheaded at home and almost fell. His wife brought him to the ER. Mr. O has been admitted to the hospital in the past and treated for congested heart failure and acute myocardial infarction. No code status available. No known allergies. Um, his Everything looks normal, and unknown IV fluids, and there's no medications at this point in time listed. Um, Upon my assessment, as of 21:30, Mr. O is not doing well. The PCA took him to the bathroom and observed black tarry stool and was complaining of not feeling well. Upon assessment, his vital signs are blood pressure 94/66, pulse was 114, respiration 24, pulse ox was 97%. He is pale, and his skin is clammy. I did not take a temperature at this point in time. The abdomen is distended, and he has diffused abdominal pain. He rated his pain 6 on the scale of 1 to 10. I believe the situation is critical, and patient could decline and go into shock. Um, Based on my observation and the assessment, my recommendations would be that Mr. O has abdominal pain, rapid breathing, black tarry stool, low blood pressure, symptoms leading to hospitalization such as syncope, weakness, lightheadedness, and almost falling, um, made me believe that there's probably some kind of bleeding internally. I would recommend giving him saline to increase his saline IV input, and or ordering a CT scan. Being that we don't know how much saline we're giving him an hour, or the type of saline, I would also would like instructions on that. I would take all the recommendations as a phone written order, and I would read back every um, doctor's orders taken by phone to be sure that I am uh, getting the exact doctor's orders. And at this point in time, I would also ask the physician, the doctor, if he is going to put these orders in the system, or if he wants me to do that. As far as nursing notes, as of 21:30, time patient was helped to go to the bathroom by PCA. PCA noted black tarry stool, and the patient stated not feeling well. Upon assessment, his vital signs are blood pressure 94/66. That's very low. Pulse is 114. Respirations 24. Pulse ox is 97%. He is pale and his skin is clammy. The abdomen is distended and has diffuse abdominal pain. He rated his pain 6 on the scale of 1 to 10. Proceeding to contacted doctor at 21:30 hours and explained the situation, and doctor recommended new orders. See chart for detailed orders and details on that. Um, as far as my thoughts on the clinical scenario, um, I believe that this clinical scenario, that the information was given to us, needed a little bit more detail. We did not have access to a medical chart for this patient, for Mr. O, which we would if we were in a hospital setting, and that'll give us more detailed information, and we would know more about the patient and relate that information to the doctor. What do you think could have been added to the S-bar? I don't know what else could have been added to the S-bar, but I think adding a patient chart to this exercise would have been very helpful for us to have the accurate information for the doctor. We don't even know the doctor's name. We don't know what floor our patient is in, what room number he is in, and we don't know a lot of those minor details that could play a big role in trying to help the doctor identify who we are talking about. Also, due to the lack of not having a medical chart, I don't have what type of IV fluids is being administered, the rate, hourly rate. We don't know a lot of these things. We don't know if he's on any other medication. The only reason why I'm mentioning IV fluids is because of mention of the IV line infiltrating on the way to the hospital by EMS, and the previous nurse taking care of him, starting a new IV and removing the old one and adding a warm compress to the old site. What do you think we do not need in the S-bar? The S-bar itself is a very complete document. As far as the scenario goes, well, I'm thinking we needed more information, but the S-bar is a very complete document and a great tool for simplifying and organizing communication between the nurses and doctors. This document was first created, as far as I know, by the FDA to improve the safety of their planes. This document was created to report incidents of planes and repairs needed, and later was implemented in the healthcare practice, according to Wilkinson's. If we do this conversation again, what should we do differently? Well, first of all, I don't have somebody else to read my SBAR. And so I'm answering these questions myself because the only people I can contact safely at this point in time would be my family, and they don't know what I'm talking about. They don't have a medical background to understand what I'm talking about. So to them, it would be very hard to give me any kind of input. That's why I'm providing this input myself. And I do believe that if we do this conversation again, I think instructions could have been a little different based on the circumstances that we find ourselves in. And I think the number one thing that we would need would be, a medical chart for this patient, the ability to be in an environment more conducive to where we can apply the scenario, such as a lab or simulation room, or being surrounded by peers that are doing the same exercise and can understand a little bit of what we're doing. I know in SBAR, once you have been in the medical field, it's going to be a lot more complete than what I've done. This is my best effort on it, and I know if you were to, what you are going to read, you're going to see you can change this, you can add that, and maybe I added, and I was a little more redundant on repeating what the patient had, and maybe that would be the one thing that I would actually take out. But I just wanted to be clear on my explanation to the doctor. One thing I want to add is I do know that doctors don't want a whole story, and they want concise and precise information when it comes to an SBAR. Being that you're giving us 9 to 11 minutes, we kind of had to extend it a little more. So those are the things that I would change. Thank you.